The first clip really goes over how we started, and to provide a framework for discussion for the care of infants with bronchopulmonary dysplasia, we described our program, our interdisciplinary program, as a way to begin the discussion about this very important problem. August of 2006, we actually launched the entire interdisciplinary BPD service line, which included and anybody who wants to come and look is welcome to come, a 28-bed single patient room nursery that houses our BPD program. And at any one time, a little more than half the kids have really pretty good going bronchopulmonary dysplasia. And that's actually been very important to not only formally, philosophically isolated as a service line, but also geographically isolated as a service line and get a real investment from nursing and respiratory therapy and so on and so on. It is its own individual service line.
Those residents of those beds, are they all sort of the classic definition?
So it's anybody that's been a premature baby that's been ventilated for a month, gets identified. We identify those patients. We identify them, we take a bunch of intake information. The goal of the intake information is to determine who they are, clinically who they are, and they actually get kind of a consult from the BPD team. Now the BPD team, it's its own separate team. So we have the ICU team, and we go over and talk to Leif, and Leif has a patient, and we go see it, and we say, well, this is a BPD, and we identify them, and we primarily are identifying them from the perspective of where they are in the stability curve of bronchopulmonary dysplasia. We meet with the parents and spend a ton of time with them because this is a biggie for them. It's a biggie for them for a couple reasons. Number one, it's a new group of docs that are going to change how we manage them because now we've lapsed from an acute care to a chronic care focus. And so we talk a long time with them, and they're actually, even when we talk with them, we find they're surprised that we're no longer drawing blood gases and we're not changing the ventilator every day and things like that because they have chronic disease.